Hello, my name is Sarah Metcalf, and I'm here to discuss the Community Health Needs Assessment that was conducted on the Dresserville Indian Colony from September 2017 to October 2017. So, I want to first discuss the logic model that was utilized in order to help us complete this Community Health Needs Assessment. We use the Mobilizing for Action Through Planning and Partnership, or the MAP logic model. For this logic model, we wanted to establish a core group and a steering committee to help us generate health priorities for this population. Our core group consisted of 10 recruited healthcare professionals, 2 mental health, 5 medical, and 3 other. And making up our steering committee were 14 committee members who volunteered to participate. Next, we wanted to focus on generating a shared vision between the two groups. We established a dialogue, helped resolve any conflicts or disagreements, and helped them focus on 4 areas of assessment that were going to get us to the most appropriate shared vision. The four areas of assessment included current community themes and any strengths within the community, the current local public health system. We looked at clinics, collected tribal data, and then conducted additional interviews, the current health status of the community, and any forces of change that may be going on. So things like language loss were looked at, PTSD, and adverse childhood experiences. Once all these assessment issues were looked at, both groups came up with 2 priority health problems. The number 1 priority health problem the group agreed on was mental health, specifically that depression and trauma care should be addressed. This included how child abuse, cultural retention, and historical trauma ultimately may be affecting the low socioeconomic status and mental instability of this population. The second priority health issue that they decided they wanted to look at was physical health, specifically obesity and diabetes. Both groups agreed that perhaps by decreasing the mental health problems and substance abuse issues within the community, there may be an increased chance of improving diet choices and lifestyle choices for this community. Our goals after setting the priority health issues were to improve cultural retention, increase trauma support, improve mental health awareness, and increase access to support systems. We were able to do this by establishing peer counseling support groups. We utilized these support groups face-to-face, over the phone, through the web, however we could get them available to the community. Added more regular cultural education events, things such as basket weaving, pine nut harvests, and rabbit skin blanket making, which are all things that are very important to the Washoe culture. And then hired an additional mobile psychiatrist. The Washoe tribe in particular have been having a hard time finding enough healthcare professionals or just professionals in general to reside on their colonies, so having the mobile option has really helped. So some more demographics about the Dresserville Indian Colony. The colony is made up of about 314 individuals in approximately 123 housing units. About 90 to 95% of this colony identifies exclusively as Native American. And for median age, there was no colony data specifically available, though the town census data was calculated at 41.4 years for the median age. But according to my windshielding survey and observations, I would probably estimate this as higher, closer to about 65 to 70 years of age for the colony specifically. And again, there was no specific data, census data available for education level, though according to community members and mentioned by a USDA grant back in 2014, the education level for this colony is very low. Household income is very low as well, about $20,000 a year is on average. 78% of tribal families fall below this poverty line. Some socioeconomic indicators would be the limited education options. It's difficult to attract and retain education professionals for this area. They're very low income, about 80% below state average. the child abuse and historical trauma rates, and how that can affect individuals for the rest of their life and in other areas of health as well. Substance abuse problems on the colony, specifically binge drinking, illicit drug use. The Dresserville colony is located in the food desert. They're about 2 miles from the closest food source, which is a gas station, so it's really not the best food source at that. And the prevalence of diet-related illnesses, specifically diabetes and obesity. So further looking at some of these priority health issues, like I said, binge drinking and illicit drug use are the main substance abuse issues on this colony. Dresserville's binge drinking rate is at 23.5% compared to the county and the state of Nevada. The state of Nevada is already at a pretty high rate compared to other states. So having Dresserville be even higher than that is a problem. And illicit drug use, Native Americans are more likely to use illicit drugs than most other ethnicities or races. Compared to the Caucasian population, the Native Americans, about 12.3% of the population uses illicit drugs, whereas for Caucasians, the rate's at about 9.5%. And then the graph on the lower left-hand side further highlights the income disparities. As you can see, the yellow bar is indicating the $20,000 per year of the average household in Dresserville makes. Compared to Douglas County, it's about a third of what the average household in Douglas County makes, at almost $60,000. And then, again, still much lower than the state and the nation average. And for the top diet-related diseases, as I mentioned, obesity and diabetes, the residents on the Dresserville colony are almost twice as likely to be obese than the community members in Douglas County, at a rate of 43.7% of their adults being obese. Diabetes, again, they're high. They're about 14.3% rate of diabetes, whereas again in the county is about 8%, and then the nation and the state average is hovering right around 9%. And for mental health issues and child abuse occurrence, Native American children are 2 times more likely to be victims of child abuse than children of any other race or ethnicity. And often children who experience child abuse have a much higher occurrence of developing PTSD than a lot of other victims. Their rate is about 50% of child abuse victims develop PTSD, still higher than suburban police officers, military veterans, battered women, firefighters, and even raped adults. So for the priority health issue that was decided upon, it was child abuse. The rates of child abuse for this population are so high. It's become the cultural norm. It's generational now. It stemmed from historical trauma where their ancestors were taken to Indian boarding schools and they were neglected and abused, and it's perpetuated from there. The high rate of PTSD and depression occurrence that stems from this abuse, the additional poor life choices that come with these mental health problems, and ultimately the poor mental health status equaling poor physical health status overall. So this relational chart further shows how this priority health issue can affect them in multiple areas and why it needs to be addressed specifically. So child abuse often leads to other mental health issues like PTSD, depression, which often leads into isolation, which usually results in some form of substance abuse, binge drinking, illicit drug use, or both, further perpetuating poor life choices, dietary choices, and overall resulting in physical health issues, diet-related issues like obesity and diabetes. So to summarize my priority health finding of child abuse, the implications is that it's become the social norm. This is a continuous cycle for this population. There are a lot of additional increased health risks as an adult, not just mental health risks, but physical health risks. Currently available, we do have the Washoe Health Clinic, which has behavioral services as well. There's the Indian Health Services, IHS, that is dedicated to serving this population. There's Child Protective Services to help protect the children that may be currently going through abuse. And the Washoe Tribe has a family healing center that families can go to deal with any trauma. Though are these resources adequate? I'm going to say no. 14.2 out of 1,000 Native American children experience child abuse, whereas the national average is 9.2 out of 1,000. But the Healthy People 2020 objective is 8.5 out of 1,000. So this chart on the lower right-hand side is showing where the Healthy People 2020 baseline is set in blue, where the nation average is just above it, and then how far above our population's average is right now. We have a long way to go, a lot of work to go. And then right above that, the pie graph is just further breaking down exactly how child abuse affects them in multiple areas: physical health, diabetes, obesity, physiological, increased depression, PTSD, suicide rates, the behavioral issues, substance abuse, and then economic issues. There's an increased cost of care not only for the community, but for the victim, and then lack of education as a result of the cost, and low chance of getting a high-paying job. So to summarize further, I want to go over some of the limitations that I found when conducting this community health needs assessment. I did find there was probably some insufficient data. There were a lot of things on the Dresserville colony specifically that the Census Bureau did not have available, and there was not a lot of quantitative data that I could reference to specifically, and I had to rely a lot on community interviews and healthcare provider interviews within this population. Community feelings and pride. Native Americans, they're a very proud race. Washoe Tribe specifically, they're very close. I feel they had a hard time portraying anything negative about the community, and may have glided over some of the health issues to avoid making the community or making any negative remarks about their community. And then historical trauma. This is deep-rooted, the cultural detachment / retainment. They may be detached from their culture, not really realize it, not really wanting to retain their culture, so uninterested in participating in this culture. They could have unresolved grief, which means they would be maybe unwilling to speak with an outsider, or being further isolated and not wanting to participate in any community assessments. Spiritual ancestor connection. Again, they may not be trusting of outsiders. They're connecting with their ancestors who were betrayed by these outsiders, and they may not be wanting to open up to me due to the historical trauma based off of that. And then unrealized pain. They could be suffering historical trauma, depression from historical trauma, and not realize it, not be able to pinpoint it or specifically portray their feelings correctly because they don't know where it's coming from. Thank you everyone for taking the time to listen to this community health needs assessment. I really had a great time looking further into this community, and I hope to further address any other issues or concerns that may come up in the future. And here are some reference slides.